And so just to close then, I just want to show you this. This is something many of you have seen from NBCA, just a flyer that goes out to make people aware of the risks of blood clots. What are some of the factors? And I don't know if we have these here to hand out, do we? I think, oh, they're in the folder, right. So you can look at this. And again, sometimes I hate to put these together because I don't want to scare people. But, you know, you say bed rest over 3 days, and a million people would call, wait a second, I'm in bed for 3 days. Am I going to get a blood clot? Well, no, that's not going to happen, generally speaking. But, you know, people who are really sedentary and immobile, usually with other illnesses, in bed for many, many days, may be at increased risk. So let me stop there. We've got 10 or 15 minutes maybe, and I'm going to stop, and I would love to answer any questions. I hope there are some questions. Thank you very much. First question back there.
Thank you, Doctor, for a very informative presentation. I have a two-part question. Platelets. Someone who has a high platelet count, and the relationship to all of this. And the second question is the factor 5. Is that a generation skipping kind of thing, or can my children, I'm a factor 5, but can my children get it, or is it the next generation?
No, it's, so your children, yes, your children can get.
Can we please repeat the question?
So the question was, let me ask the second part, is the factor 5, people who have that genetic predisposition, does it skip a generation or can it be transmitted to the children? And again, it can be transmitted to your children directly. About a 25, if your wife does not have it, about a 25% chance that a child will have it. Yes, it can be transmitted to children. And this first question was about platelets. If your platelet count is high, is that a risk factor, or is that the question, I think? And the answer is yes and no. So it depends on how high, and lots of individuals have mildly or moderately high platelet counts for underlying reasons, and it may not be a factor at all, number one. Number two is it depends on what the underlying reason is for the elevated platelet count, was that may itself be a reason for increasing the risk of a blood clot. And number three is if it's very, very sky high, most doctors tend to treat those patients with a prophylactic dose of aspirin, but even that is challenged nowadays as to whether that's really needed. And so that's perhaps the most I can say about it.
Just follow up. If the platelet side number is low, does it affect?
Yeah, so if the platelet count is low, does it affect? So if you have a very, very low platelet count, anybody, you're at increased risk of bleeding. Now, normal platelet count is about 150 to 300,000 platelets per drop of blood, and a low platelet count, very low, tends to be less than 50,000, not 100 or 120. Those are okay. But as you get below 50,000 platelets per drop of blood, and particularly below 20,000 platelets, the risk starts increasing in anybody that has that problem, depending on the cause of the low platelet count. Now, if you have that with a blood clot, and the situation where that arises often is patients who have cancer, have a blood clot, and are on an anticoagulant, and then they're treated with chemotherapy, and their platelet count falls. And so it's a difficult problem. And if your platelet count falls very, very low, most doctors will stop your anticoagulant therapy during that period of time. But if it's sort of drops moderately, then it probably won't be interrupted. But yes, a very low platelet count will increase the risk of bleeding with an anticoagulant. 75,000, I don't want to give specific consultations here, but 75,000 is generally a safe number, generally speaking. Yes?
Yes, first of all, thank you for having this forum and the excellent presentation of those slides. They were very clear and very easy for patients to understand, so I appreciate your clarity. Now, you had mentioned there are other risk factors that were not put up on that slide presentation, and I want to talk about the risk factor I had with the DVT in my upper right arm, and that was due to a supervised medicine ball study, one-on-one, the repetition of throwing the medicine ball too many times. I was too good at it, caused my DVT.
Okay, so the question is that you had a DVT in your right upper arm because of physical activity with the medicine ball. And so those things can happen. Now, typically, or I would say generally, I would be concerned that there may be some other structural things in your shoulder or arm. And there are individuals who have either their vessels are compressed between muscles or they have an extra rib, which some people have. And you did. So that in itself, all right, well, right. So you're right. Maybe that the people that did the study should have said that. I don't want to comment on that, but there are lots of things like that that can happen. I took care of a baseball player a number of years ago who had a pitcher from a local team here many years ago, who a professional baseball player, and who used to get blood clots in his arms after pitching a game. And now his were arterial blood clots. And he ended up, he had a compression of an artery and so forth that after repetitive movement, 90 pitches or so, that it caused injury and it led to blood clots. And he had a number of these types of things. So those sorts of things. Well, you know, you can't list every risk factor. So, you know, sitting in this chair for a dozen hours could be a risk factor. But I can't, you know, you're not going to list everything. So I think it just to be aware.
We'll take one more question, or maybe two.
Yes.
This is a short one.
Could you explain for those not at risk why compression stockings are not recommended as a preventive measure?
For those not at risk. Well, for those not at risk, you may not need prevention, depending on what you're doing. I mean, if you're just on a long flight. All right, so I would say that that if the risk is not there, number one, there's no sense in putting stockings on and buying them and so forth. There actually are some studies that have suggested by wearing stockings, you actually, I don't want to get too crazy here, but you actually can increase the risk by constricting the vessels, although the general studies suggest that for those at risk, it does lower it. Generally speaking, that, you know, you could say, let's give them to everybody on a long flight. And I just think it's not cost effective if there's no need. If you simply get up, if you simply move your legs, why put on elastic stockings? So I would say that that's probably, you know, why we wouldn't necessarily want to use it. If that's it, one more, yes.
Hi. I've been on Coumadin for 12 years, probably 15. I need to be on it for the rest of my life. So the side effects or risks, the only one I'm hearing is bleeding. I want to understand better if there are other issues or concerns with taking it for my whole life.
For Coumadin. All right, so the major significant risk is bleeding, yes, and it's probably the only one I would really worry about. There are some patients who complain about hair loss with Coumadin, but it's never been absolutely shown that Coumadin is responsible for that. And there are other reasons why some people may have hair loss when they start Coumadin. So I have some of my own personal feelings, but there's really, but that's listed as a side effect. There are some other conditions, some paradoxical clotting events that can occur, but it gets very complex. It's rare. It's not something I would worry about. Somebody who's been on Coumadin for years, it's not a concern. There are some rare people that feel that they have allergic reactions, skin reactions to Coumadin. I'm never quite sure that those have been well documented. So there are some other things that one might, you know, read. If you look at the package insert that comes with Coumadin, they may list a lot of things, but really, I personally, none of those are significant enough to say you should stop taking Coumadin because they're worse than the possibility of having a blood clot. And the only one that you have to be concerned about really is bleeding. Quality of life and diet and all those other things are not risk factor or not adverse events, but there are things that affect how you live your life and you know, things that people don't like very much with Coumadin. Okay, thank you very much.
Thank you very much.